Okay, welcome everyone. We'll get started in one moment. I see that we still have some folks joining in for the webinar today. So let's just give it one moment. There we go. Excellent. Okay, why don't we go ahead and kick off. Welcome to KnowledgeWorks Global Learning webinar on healthcare learning trends and innovation. This is part of the KGL webinar series. I'm Kelly Lake. I'm the Global Head of KnowledgeWorks Global Learning. Today's webinar is scheduled for 60 minutes today. All participants will be placed on mute for the duration of the webinar. One thing that I will recommend, on the right side of your screen, your panelist view, you can actually enlarge the panelist view. When we go through this, there will be a PowerPoint as we'll go through this to support our discussions, as well as there'll be demos. So you can adjust that panelist window accordingly. Okay. There we go. Let's start with the agenda for today. So we're going to kick off the webinar with a high-level overview of the L&D industry within healthcare, just to level set where we are. From then, we're going to jump right into the Learning Trends Insight. That's the best part of the webinar today for everyone, with our panelists, and I'll introduce them in just one moment. But we're going to drill down a little bit more in those trends, learn a little bit more realistically what's happening in a healthcare situation within an organization, talk about some learning strategies and also workforce enablement, and then dive down further into technology innovation and learn what's happening in the industry, how that's comparing against what you're currently doing with your strategy. And then we're going to see some really fabulous demos that we'll talk about in a few minutes. Then we're going to wrap up with a Q&A session. And if you look at the bottom of your screen, there's a Q&A button that you can click open and answer your questions as we go through. We will address them at the very end of the webinar. The session is being recorded, so that's the good thing. So if you've registered for this webinar, you'll receive an email link to allow you to go to that. Plus, it will be posted on the KGL Learning website as well. So if we don't get to your questions, don't worry. We will follow up with you after the webinar. We want to make sure that everything gets addressed today. All right. So without further ado, let me go ahead and make introductions. And I am excited to have these two gentlemen as part of the panels today. They are two industry experts, Kevin Preston, who is the VP and Chief Learning Officer for Presbyterian Healthcare Services out of New Mexico. Kevin is an amazing and dynamic leader, not only from a learning and talent perspective, but also engaging organizations in being proactive and increasing performance and really growing people. Kevin has been a part of the industry for a very long time and has led many healthcare organizations. So Kevin, welcome. Excellent.
Ellie.
Great to have you, Kevin. Also, another industry expert that we have with us today is Raj Arora, who is the founding partner of eLearning Design. So within the ELDC Design Center, Raj is one of the founding members. He's also an industry expert when it comes to immersive solutions. So we're very fortunate to have him today because his expertise ranges not only from AR, VR, but 3D training all the way to AI and machine learning. And Raj is a wealth of knowledge and information, and he's actually going to give us some more insights to innovation and also do some demos. So Raj, welcome.
Glad to be here. Thank you.
Thank you so much. So let's go ahead and get started. I want to just do a high-level overview of what's impacting the healthcare industry today. Obviously, we've seen huge influxes across the board on so many different things that impacted where we are from a leadership perspective when it comes to learning and talent management. One of the biggest things has been the result of the change in the industry post-2020 to the change of where we're going in the industry. So, we can see tremendous growth within healthcare. You can see I've added some stats, just to give you some food for thought as we go through when you're hearing from Kevin and also when you're hearing from Raj, why we're growing in the industry. So not only are we growing to a phenomenal amount of $148.2 billion up to 2030 within healthcare, but also we're seeing that from an e-learning perspective or a learn perspective market from a growth all the way up to $1 trillion in 2027. Now, what's causing that? one of the first things, and Kevin's going to go into detail a little bit more about, there has been a big push. We've lost a lot of health workers in the industry since 2020. And that's a huge impact on how you're going to be able to not only identify qualified people, but actually be able to work with them on skilling them and upskilling them to get them to the level that you need them to be, but also the job market, how that's going to transfer and into qualified people. There's different technologies and there's different things that we can look at, but the job market itself within healthcare is expected by 2029 to target 2.4 million jobs. Now, if you translate that to what that means for talent and learning, companies right now and have been challenged to fill those gaps. And what are those gaps and what are those new techniques that you need to be able to close the gaps very quickly? Not only from, rolling out simulation training and scenario-based training, but really getting into immersive experiences to close that gap very quickly. But there's different techniques that need to be in place in order to reach those goals. And then also it's that ongoing push for virtual learning as we move forward with that. The number one thing that we hear across the board is learner engagement and making sure that you're able to not only attract the right talent, skill them, reskill them, but also ensure that they're in the correct job and we're moving forward on that learning path. So let's go ahead. And I think that the perfect place to start for the panelist discussion is with Kevin. So Kevin, I thank you for your time and being on the webinar today. And, with the challenges with the gaps, right, in talent out in the field right now, how are you approaching this? Because it's a huge gap as far as the talent shortage.
Yeah, and I appreciate that you already kind of set this up, Kelly. And Kelly and I have known each other for 20 years, 20 plus years, seems like. So it's been a long time. And the healthcare industry is always a challenging place. It's always a wonderful place to work, but it has a lot of challenges. And we've had talent shortages for a long time. We've known for a long time that there's going to be a nursing shortage, for example. And we know that many of our nurses are nearing retirement age, and so that opens up opportunities to say, what are we going to do differently? And I wanted to really start out with, like, who is Presbyterian, because it does add a bit of a dynamic to the challenges that we're facing. And if you haven't heard of Presbyterian, we are a regional healthcare system. We're based in Albuquerque, New Mexico. And New Mexico, for those of you who don't know, it is a state. It's a state in between Texas and Arizona. So if you're trying to picture where it is on a map, that's where it is. And New Mexico's a beautiful place, and it has deserts and mountains, and it's a wonderful place. It's also very sparsely populated. There's only about 2.3 million people in the entire state of New Mexico, and it's a big state. And so that adds some challenges. Presbyterian is a healthcare provider that goes across the state. We have regional facilities in small communities. We have urban facilities in some of the larger cities in New Mexico. And there's a lot of distance in between those places. New Mexico has a lot of poverty as well, and has a relatively low education rate compared to other states. And so when we think about that, we think about the 13,000 plus employees at Presbyterian. That really adjusts how do we fill those needs that we have, those staffing needs we have. We're both a healthcare provider, so we have hospitals, clinics, that sort of thing, as well as an insurer. So we have a health plan, and that makes it really interesting here because we can do a lot of population health work here. Because we are the insurer and the provider of the care, we can do really innovative things, but we need people to do that. And in 2020, when the pandemic hit, we had the lowest turnover in our history of us tracking turnover. It was phenomenal. People were very nervous. They wanted to stay put, and the clinicians really wanted to do what they could to help with the pandemic. And it was hard. It was really hard for them. And they've done phenomenal work. And I'm sure you've all seen the phenomenal work that clinicians in your own communities do. And they're tired. They're exhausted. They spent a lot of energy doing the work that needed to be done. And as a result of that, in 2021, we had the highest turnover that we've ever had on record. So a complete switch. Many clinicians decided it's time to leave, time to retire. It's time to maybe leave healthcare. Maybe they want to do something different. There's a lot of stress. The work environment can be a challenging work environment for individuals. And so all of those things are these challenges in front of us. And so what we're focusing a lot of energy on right now is identifying new sources of talent pools, new places where we can identify people who want to be a part of healthcare. And healthcare, I think, historically has had this concept of it's a noble calling to be in healthcare, to be a clinician, to be a doctor, a nurse, a radiology tech, one of the many ancillary roles that does all of the amazing work that happens. It's historically been a noble calling. And the pressure and stress and danger, frankly, of the pandemic has lessened a little bit of that. So it's harder to get people to be excited about a healthcare career. They are, but it's more challenging. And so we're really trying to focus on where can we go into the community, get young people excited about a career in healthcare. Go to high schools, go visit high schools and say, do you want to join healthcare? Join us to come here. And so we have a variety of programs that we're really trying to identify by looking at maybe individuals in the military who are thinking about transitioning from into a civilian role, who have clinical experience. How can we help get them to join us at Presbyterian, or recruiting at different schools? Or we're even working on externship programs where we know that as people are in, let's say, nursing school, for example, while you're in school, you can't work as a nurse, but if we can hire you as a nurse extern, kind of like an intern, right? We can get you here, get you excited. You earn some money while you're finishing school. We get the benefit of having you here doing limited work, and you're more likely to join us once you graduate and pass your NCLEX. So those are some of the things that we're doing to address the talent shortage.
And Kevin, that's really great insight, because, I think so many organizations or healthcare systems are struggling so drastically with that. So I think that insight is really good. So the things that you're currently doing right now to attract new talent, what areas have you been successful in, or what best practices can you share back with attracting the new talent that you're looking at right now?
Well, I think one thing we're excited about is we're beginning to craft a new employment brand and really think about not only our brand as an organization who is Presbyterian, and it's well known. If you live in New Mexico, you know who Presbyterian is. We're the big player here, and there are other great healthcare systems here as well. Presbyterian's the largest of the healthcare systems, so we're well known from a system. We want to be well known as a great employer as well. Why would you choose to come work here? What's great about working here? And focusing that employment brand on how do we do things here, and how do we do things here in a way that matters. It matters how you do work. It's not just the work that happens, but how it gets done. How we show a sense of belonging with one another, inclusion. New Mexico is one of the states in the US that is a minority majority. We have a lot of diversity in New Mexico. There's a large Hispanic population, a large Native American population. How do we all feel like we belong here and that we're all included here? Those are some things that are really important to us to try and attract employees. And we also do a lot of community outreach. And I already mentioned a little bit of that, like, going to high schools, for example, trying to get people excited about it and trying to get them to realize that there are more jobs in healthcare than being a nurse or a doctor, right? So a lot of people think, well, I don't want to be a nurse, or I can't be a nurse, or I can't be a doctor, or I hate math, so I don't want to do those things. That's okay. There's a million other jobs in healthcare, and we would love to have you in many of those jobs. And if you want to do bedside patient care, there are great roles to do that. You could be a nurse tech, you could be a medical assistant, you could be an echo tech. There's all kinds of really cool jobs, and getting people excited about them is one way that we want to really try and help build our pipeline. And I guess the last thing that really sticks out to me is, as we attract new talent, one of the things we really have a big focus on is residency programs, where when you have a clinician, usually a nurse or an advanced practice clinician, they go through school, they graduate, and then they've done clinicals in school, right? They've gone into the hospital and they've practiced things in a supervised environment, and yet it feels nerve-wracking to be thrown out to the wolves, right? And so having a residency program where we can transition them smoothly from school to practice is really valuable. And when we do those, when we have new graduates go through these residency programs, their retention rates are about 75% higher than the retention rates of a new grad coming in and not going through a residency program. So they like it, they feel more supported, they feel better. We know we get better, higher quality care from them. So those are some of the things we're doing.
That's great. And it's really interesting to hear about the residency and your retention, right? That 75% is pretty impressive. And then also too, realizing that healthcare jobs go across the board, right? So it's not just you're talking about specific or middle, but, developing, like, we're going to talk, and I'm very curious too, Kevin, for your perspective, is now that you've talked about, your talent, how are you going about, developing these employees on all different levels and all different roles?
Yeah.
Mm.
Yeah, I mean, I think I love that you just brought up the different jobs, and we have a lot of jobs here. And as I mentioned earlier, Presbyterian has a health plan in addition to being a provider of care. And so there's lots of jobs in the health plan as well. We have a call center. We have hundreds of people that work in a call center, and the call center is where you call when you have a question about your insurance, or that you call to a different call center if you need to make an appointment with your doctor. So there's call center jobs, there's admitting registration jobs, there's environmental services, there's all these jobs. And so another thing that we do here is we have a career coaching service. So we let people who are interested in saying, you know what, I'm here, I want to be at Presbyterian, I love this organization, and I want to advance my career. Can you help me with that? That's where we can do some career coaching with them to say, have you ever thought about maybe being a medical assistant? Have you ever thought about, being going into maybe an accounting role or a finance role, and then helping those folks uncover those things. Sometimes we'll get calls in the career coaching center about, I want to be a nurse, but I don't know how. Oh, well, we can help you understand what that looks like. We can help you understand what that career path looks like, what that financial career path looks like. Is that the right thing for you to do? So some of those things are kind of on our list. And then from a development perspective, as we take that even further, this is where we would start thinking about, advanced clinical preparation. And we have a simulation center that we're expanding right now. And in our simulation center, we do advanced clinical simulations. So what that basically means is that we take interdisciplinary teams that work together already, let's say a doctor, a nurse, maybe a surgical tech, maybe a surgeon, whoever's in that work environment together, we put them into a team and we run scenarios for them. We run scenarios for them to see how they interact with each other, what they do well, what needs to be adjusted. And that is a really cool experience. We love to put them in immersive learning environments. So sometimes we love to use a patient room, for example, that mirrors the real patient room. So sometimes we'll take a room at the hospital and we'll just use that room. And, it's important to have that so that you're not running a simulation kind of just, without it feeling like it's your real work environment. We want to build muscle memory, right? So what is the first thing you do when you come in the room? Well, you sanitize your hands, hand hygiene. So the sink, the hand sanitizer, it needs to be in the same place that it is in your real work environment so that you get into the muscle memory sort of things. And we have really cool high-tech things that support that environment as well. So the idea of having some high fidelity mannequins. We have one mannequin that we use for simulation. His name's Hal. Hal is a pediatric mannequin. He's a little kid. He's 10-ish probably, and Hal can talk. Hal can move his head. You can give Hal an IV, his eyes dilate, all the things that you would expect. And we can run simulations with those interdisciplinary teams who would be working with a patient like Hal to see how do you interact, not only on the clinical perspective, but on the team perspective. Do you communicate well with one another? Do you bark at one another? Are you respectful with one another? So all of those things go in. We also have another really cool mannequin, Lucina. Lucina is a birthing mannequin, and we've had birthing mannequins in healthcare education for a long time, right? But the cool thing about Lucina is that she also has a augmented reality component. So she's in front of you. She is, in labor. The baby is in the stomach. You can feel the baby. You can feel how the baby's positioned, and you can practice things like a breech birth, let's say, and you can feel how the baby's positioned. But you can also use the augmented reality to see in utero what exactly does the baby look like in there. Where's the cord? How's the baby positioned? What is going on there? It's something you can't see in a regular mannequin. It's something you can't see in real life, but it makes something click in people to say, I get it. I get when I feel this, that's what's happening inside. So we have some really cool things like that we're excited to continue expanding.
Kevin, that's actually wonderful examples. Thank you for sharing that. And it's great to see the journey from, being able to, and just take it to the next level with bringing in talent. How are you doing that? What's the story behind it? What techniques are you using? All the way to how are you growing your employees, right? And growing your employees across the whole entire landscape of what you have there. That's pretty remarkable. And I know that I saw Raj perk up there when you started talking about simulations with AR there. So I think that's perfect. And Kevin, thank you again. I think that's really great. And as we go through with Raj, I'd love to, we'll talk a little bit more about some feedback on what we're seeing. I think that's going to be pretty dynamic to do as well. And, what you've been sharing and talking about has been really great for us. So with that, let's turn over to Raj for a second. And Kevin, thank you. So Raj, from your perspective and being an industry expert on innovation, as we were hearing what Kevin was talking about, and I'm sure across all of the clients that you've been dealing with, can you just give us a little bit more insight on what innovation you're seeing in the industry now?
Yeah, definitely. I think when we started, like I'm talking around from past 4 to 5 years, there is a buzzword around when we talk about simulations. Yes, mannequin-based simulations, but a lot of hospital systems and universities are exploring the venues of virtual reality, augmented reality, and mixed reality. Yes, all these realities have a lot of scope within this, and we are just seeing either some of the hospital systems want to implement or exploring the procedural-based simulations, and some of the hospital systems and universities are exploring scenario-based simulations. So basically, there are two types of VRs or augmented reality or mixed reality, or we can call it XR. That comes under XR is extended reality, in which AR, VR, and mixed reality comes into play. So either procedure-based or scenario-based. A procedure-based simulation is something where we are replicating the real-world procedures. To name a few, like NG tube insertions, intubations, tracheostomy. So all these critical procedures that you replicate within a VR world. A scenario is an open world scenario where multiple user can able to join and do a scenarios like bradycardia, tachycardia, ST elevations, cardiac arrest. So all kind of those simulations. Both have a very, very important role to play. Either we are doing within the virtual reality or on Medicum base. Both have their own importance and features as well.
Right. Are you seeing, Raj, more movement towards AR, more movement towards VR? What is there a mix to it, or what's your perspective?
I think AR has its own importance and VR has its own importance, but more movement towards virtual reality and within the virtual world, as we see. Because within AR, it's augmented reality as a tool is very good, but within AR, we can visualize things, we can interact things, but we cannot interact in a way where we can perform the procedures. We can like zoom in and zoom out and visualize what goes on within the body and visualize the different parts of the body and visualize the procedure. That's it. But when it comes about practicing and application, it's more VR based, right? And as we go towards new headsets and new hardwares are coming, that is making the life so easy. And there's a lot of new innovations in terms of sensing the things, feeling the things, like touching the skins and performing those procedures, squeezing from your hand. I'm gonna explain that within once I start presenting it. I don't want to discuss right now.
That's okay. This is the perfect time because we're very excited, and I'm sure everybody
Absolutely.
that's on the webinar is excited to see some of your demos. So without further ado, we're very excited. And maybe you can explain a little bit too, Raj, about MedVR and the importance of it and how you've developed all that. Okay.
Absolutely. Thank you.
And Kevin, as we go through anything that you see that please feel free to jump in, and I'm sure that you'll have plenty of comments as we wrap everything up. So thank you.
All right. So to give you guys a little bit of background about MedVR education, we started MedVR education around 4 to 5 years, almost 5 years back. Again, Kevin brought up some good points related to talent development and the problems that different hospital systems are facing. And we talk with different hospital systems day and night about how we can upbring the skills, how we can reduce the skill gap. So all these things are, that's where our focus is as a MedVR education, that how we can build different kind of products and within the virtual reality and extended reality that will help students and users to practice those skill sets, to build those skills by using the VR technology. The two most important features that I want to mention here once we talk about VR, the first is photorealism, and the second is physics-based interactions. So no matter like what solution or whether we are diving into VR or if anybody is interested to build virtual reality within their hospital systems, photorealism plays a very important role. As Kevin mentioned, that immersive learning and immersive experiences, replicating the real world environments. Either in reality, we are taking the patient students into a patient room to understand how things work, or we are putting a VR headset on them and having them experience within the virtual environment. It should look exact the same, the patient room, the patients, the instruments, and things like that. So as you see on your screen, all these environments, we plays a very vital role in bringing this photorealism within the VR world. And everything runs on an Android-based wireless headsets. You don't need to run this on a computer or a gaming computer to run these simulations. It runs on a wireless headset like Oculus Quest 2 or a Pico or a HP. So users can take these simulations from anywhere around the world, and not a huge amount of setup is required. The second important thing that I mentioned is physics. So when we talk about physics, is anything that you see, like if I click head to toe assessment, right? This is all physics into it. There is nothing is run through animations. We will be demoing the products like physics also. Like if you drop things, it will drop on the floor. You can pick it from the floor. So everything replicating the real world physics within a VR, that's very important for any VR solutions. Maybe you are exploring some VR solutions or building any VR experiences. So photorealism and a physics-based interactions will be the very important key if we want to do justice with this technology. And going forward, why we say physics is because also the haptic gloves that are coming up within the VR. Through that haptic gloves, you can connect those haptic gloves with your headsets, and you have a real world feeling. You can touch patients, you can squeeze things, you can do the IVs and NG tube insertions, intubations. So that's where what you get the real world feeling with mannequins, and that's where you will get a real world feeling with those haptic gloves. I think I pulled up somewhere here real quick. So this is the haptic gloves that are coming in all the simulations. These are wireless haptic gloves, and it don't require a huge amount of setup. If you talk about 2 years back, talking about the haptic gloves we were experiencing with one of our hardware company, those haptic gloves were costing $80,000, which is like insane to implement, which is not at all possible and not at all about scalable to implement. These haptic gloves, it's still reasonable. It's a $6,000 a pair, and which is very, very reasonable as compared to what we were thinking 2 years back. And we already tested these, and we are implementing these in intubations, central venous catheter insertions, and PICC line insertions, and they give absolutely real world immersive feeling. So so many of our hospital system, our partners, like they can, okay, these are all good, physics is good, but we are not getting a real world feel, tactile feedback within VR. This is what the solution of tactile feedback. And from here, there are a lot of hardware companies that are bringing other haptic gloves and other solutions. So the future of XR and VR is very bright. And when we blend it with right kind of solutions, as Kevin mentioned, the mannequin-based simulations and all, we can reduce the skill gap. And it's all about practice before they feel comfortable and confident on performing those procedures on a real patient. So procedures like when I mentioned about procedure skills, like same NG tube insertions, and if you see everything, it runs through physics. I mean, there is a component of physics involved in all these things. Again, scenarios like open assessments, talking with patients, assessing the patients, doing procedures with virtual assistant. Everything is here. It's multiplayer also. So like, for example, students or users can join from different cities, different states, from different parts within these simulations as a multiplayer also. They can talk to each other, they can collaborate with each other, and they can perform things. There's one more example before we dive into, like, look at this. These are this is the session that we do within multiplayer for intubation, endotracheal intubation. So it's a group from UCLA and University of Toledo and MedVR education team. We perform from different locations and just practicing the intubation, how to do endotracheal intubation. All right, I think we can dive into a couple of demos within this, where we can give you the exposure of how the actual output looks like. And one of our director XR will be wearing virtual reality VR headsets and Oculus Quest 2 and streaming the content on the screen. So where you guys can see the quality and how things work within a VR setup. All right. Dibesh Par, can you share your screen whenever you're ready? Take at least, I'm sure you're ready, right?
Sure, Raj, I'm ready. Yeah.
Thank you so much. Yeah. So,
Right. Can you
guys,
see my screen?
yeah, we can see your screen. Thank you. So he's wearing a Oculus Quest 2, and the entire application library is in front of him. And any simulations we can go into runs on a wireless headset. Everything runs on cloud also, so everything is over the air updates. You know, like you don't need to download, sideload, install anything within the headsets. Everything is over the air updates. If we are updating anything, just connect it with the Wi-Fi, it gets updated. And if we are building new content, everything gets into the headset. And all right, and can we go into any? Can you scroll down? Colostomy. We can do colostomy. Yeah. He's streaming the content through Zoom, and on this thing, you might see the graphic quality is little less, but when you wear a VR headset, it's absolutely realistic.
Use your joystick to test your current movement speed and adjust if required. Select Done to proceed. You can press A on your right. Welcome to the colostomy VR training session.
Can you do a patient
assessment
preparation
mode by selecting the
for
button
1 or
on the
2
top
steps,
right.
and then do
Read the help
the
instructions
changing
to know
ostomy?
about the navigations and how to interact in the scene. Follow the instructions and continue the conversation with the patient.
Hi, my name is Dibesh. I'm going to be a nurse today. Can you tell me your full name and date of birth?
My name is Jamie Connors. My date of birth is June 11th, 1963.
Follow the instructions and continue the conversation with the patient.
Thank you.
Follow the instructions and continue the conversation with the patient.
Your doctor has ordered for your colostomy bag to be changed. I'm going to get the supplies and I'll be right back into changing it.
Okay, that's fine.
Grab the handle to close the door.
This is a training mode, and in the training mode, you will get all the instructions,
Grab
what to
and pull the
do,
sheet
more
to
learn by
uncover the
doing.
patient. Perform hand hygiene. Use the sanitizer and rub both your hands. Follow the instructions and continue the conversation with the patient.
I'm going to take off the old bag, assess and clean the stoma and skin. Then I'll fit in the new bag on. It won't take very long and shouldn't be painful.
Okay, that's fine.
Grab the remote and press the highlighted button to adjust the bed height. You have now completed this lesson. Press X to start the next lesson.
All right, I'm jumping to the next lesson.
And return to
Yes.
the login.
Okay.
Found the non-sterile gloves. Follow the instructions and continue the conversation with the patient.
I'm going to pull up your gown a little bit to expose your colostomy.
Okay,
Lift the patient's gown to expose the lower abdomen. Follow the instructions and continue the conversation with the patient.
I'm going to use this wipe to help separate the adhesive from your skin. It just makes it easier and less painful. It may be a little cold. Let me know if it is painful and I'll stop.
okay,
Pick up the white package and tear it with your other hand. Dispose the wrapper in the bin. Using the wipe, Clean the edge of the bag. Dispose the wipe once done.
So you see there is a whole scaffolding on the actions.
Now, grab the bag and dispose in the bin. Follow the instructions and continue the conversation with the patient.
Now that it is off, I'm going to clean around the stoma.
Okay.
Grab gauze and dip in the basin to moisten with water. Next, use the soap gauze to wipe the skin around the stoma. Dispose it in the bin once done. Ugh. Now dispose it in the bin. Use a paper towel to wipe the stoma. Ugh. Follow the instructions and continue the conversation with the patient.
How are you doing?
I am fine.
Follow the instructions and continue the conversation with the patient.
You have a couple of long hairs. I'm going to trim them. So next, when you change a bag, it won't pull and gives a better result.
Okay.
Grab the trimmer, clip the hairs and keep it back on the table. Ugh. Grab and open the kit cover. Grab the scale and place it over the stoma to measure the size and see which one will fit best. Place it on the table once done. Take the wafer from the kit and place it on the table to measure it. Now take the measuring guide and superimpose it on the wafer to mark the size. Grab the moldable ring and pull it with your hand to mold it. Now place it around the stoma. Hold the scissors in one hand and take the wafer in other hand. Press the trigger to use the scissor and cut the wafer out. Place the wafer on the stoma.
So you see there is a video playing there for the scaffolding for critical actions.
Grab and remove the sticker
All right.
from the wafer and dispose it.
Thanks. Dipesh, can you go to the some other simulation? So this is a training mode. If you go into the assessment mode of colostomy where you don't get learned by doing, no instructions, and you have to perform those steps by yourself, that's where we assess them. Can you show the assessment mode? Like just quick, that's okay.
Oh,
That's okay. Thanks. All right. Can you do some either patient room cleaning real quick? Glimpse of patient room
Sure.
cleaning. So this is, we are working on environmental services library with Mount Sinai and Children's Health, building a largest library for like patient room cleaning, OR room cleaning, acute care cleaning, where you can use these modules for onboarding or regular competency-based trainings yearly as well. And there's a lot of research on
Before you
this.
proceed, welcome to the patient room cleaning VR training module. Read the help instructions to know about the navigations and how to interact in the scene. To launch the training,
clean the
select
touch
any of
points,
the
I
6
think.
modules available on the main screen.
okay.
Cleaning the touch points. Yeah, real quick.
All right.
Close the cart door. Pick up the wipe. Now, wipe the entrance door handle.
So this is one of the patient room of Children's Health that is fully replicated within the 3D. And there is a timer on that.
Wipe the
Yeah.
towel dispenser.
And whenever he touches anything, any instrument, there is a full vibrations and feedback of like you started touching and cleaning it.
Next, wipe the soap dispenser.
Can you show us the room little
Sure.
bit inside? And so you have to go through and do all the cleaning that is within sequence. And then when you go to the assessment mode, you have to make sure that you learn the sequence and do the assessments within that. Cool. Thanks, Devesh. Can we see something else to
Sure.
maybe an ACLS? So these are all procedure skills. So now we can get a glimpse of scenario, like how the scenario-based learning. Like any bradycardia, tachycardia. Yeah.
All right.
These are multiplayer scenarios. I mean, I can join with him or anyone can join within his session.
Before you proceed, welcome to the ACLS VR training session. You can switch to assessment mode by selecting the button on the top right. Read the help instructions to
All right, let's start.
Can you show us the room a little bit? I mean,
Sure.
Hi, my name is John. I am your virtual caregiver and I will be performing various tasks with you. This is the virtual patient and here is the list of tasks that you need to perform before proceeding with the medication. Stand in the circle to view the checklist and assess the patient. Press and hold X to speak and don't forget to call my name if you need any assistance.
My chest hurts.
assess the patient by asking questions and proceed with the patient preparation.
Hey, hi, good afternoon.
Hello.
Why did you ask for medical assistance?
I was feeling tired and maybe a little dizzy.
Okay, do you have any medical history?
I have diabetes.
Any allergies?
Yes, I'm allergic to morphine.
And do you take any medicines?
Yes, I take metformin.
So all these
Okay.
questions are based on OPQRST. So there is an algorithm for doing bradycardia, and the students will learn into this OPQRST in the training mode. They will perform, they will identify. But in the assessment mode, we'll have 4 cases, which the students or users have to go into those 4 cases, and they have to assess patient and identify whether it's a bradycardia case or a tachycardia case, or it's ST elevation or cardiac arrest. Based on that, they have to give them the medicine. They have to do the different things that are required for that particular situation. Devesh, can you
Yeah.
interact with something like a
Yeah, sure.
medicines and all?
Hey, John, John, can you place the IV?
Got it. Done.
John, can you connect the 3 leads of the patient monitor?
Sure.
I'll do this by the time.
Placed all 3 leads.
John, connect the blood pressure cuff.
Got it. VP cuff is in place.
John, can you place the nasal cannula?
Sure.
Can you interact with anything else like medicines and all, like things like
Raj, I'm in the training mode, so I have
Training
to go
mode.
through this step. Yeah.
Nasal cannula is connected to the O2 outlet.
John, place the pulse oximeter.
Okay.
So after this, I'll interact.
Place the leads on the patient.
Place
to
the
print
oximeter.
ECG. Print and observe the ECG. Administer the atropine. Assemble the shot before administering it to the patient.
Yeah, now I can interact.
So this is complete training mode, but if he goes into the assessment mode, that's where
Dispose it in the bin.
all right, thanks, Dipesh.
Place the
So, guys,
defibrillator pads
scenario-
and
Yep.
green leaves on the patient.
Scenarios are more about doing the open assessments. Right now, he was doing a training mode, but open assessment is where of this bradycardia case where he will join with other multiplayer users and identify a case that it's a bradycardia case by assessing the patient.
Wonderful. Okay, so Raj, just while we still are on the same topic here, can you just explain a little bit? We have some questions that are coming through in regards to organizations. I mean, what you showed us is very dynamic and very exciting. But if an organization, a healthcare organization is just starting out, what is your recommendation? Because it might be overwhelming for them. They say this is fabulous, but where do they start? That's the question that we had raised.
I think if the organizations, like there are a lot of organizations that are just starting out, and the first step is to, the very first step is to just try, get a trial of different products, trial don't cost anything, and see how they feel it, their clinical educators feel it, or students, if it's a university, see how students feel it and how professors and instructors are feeling about this kind of learning, and try those products, try those solutions, and then figure out things that where they can implement, what problems they can able to solve with those solutions. So trial is the first thing, and trial starts to go in the market, buy Oculus Quest 2, which is not a $5,000 headset, it's a $400 headset. It's worth spending that much money. And in MedVR Education, we provide a whole full 1 month of free trial of all the simulations, So that's where hospital systems and universities gets very excited. Like, okay, they have the free trial and we install on their different headsets, and boom, like they try it for their environmental services, for their clinical skills, for their procedures and scenarios. And then that's where they generate an interest and a buy-in from their top management also, like, yeah, this is something that can solve a problem,
Very
So,
good.
yes.
Excellent, Raj. I appreciate that. So we do have Q&A coming in, and that was one of the first questions I thought that was really poignant to ask you as we move forward with that. So Kevin, based upon, obviously, seeing some of the examples and what Raj has been showing, a question was raised, being a leader, a CLO within a healthcare organization, if obviously this is one initiative, but a lot of because of budget, because of some other restraints, how do you deal with resistance internally when you're trying to get either a learning or a talent management initiative in place? So that's a struggle for some of the people that are actually on the webinar today.
Yeah, I think that the learning function should not be the function that's driving the topics that we're talking about here. And I think that's where we often get into trouble, where we're like, oh, well, I saw this demo and I think this is really cool and we should do that. But if it's not the business problem of the organization, you're gonna struggle there. So, I think the best way to go is to be at the table to figure out what are the things that are problematic, what are the big areas of quality problems, revenue whatever the things are, and then find the solution that meets that. So let's say it's reducing sepsis. Then that is an easy sell. Like, hey, I know we're already working on this. Here's one solution of how we could help from a learning competency perspective of clinicians identifying sepsis earlier, more accurately, to avoid complications from that infection. So I think that's the way to do it, instead of us driving the bus on things that we think are cool.
Right, exactly. So I'm just going to go through, we have a few minutes left, but there's some questions that came through that I'm just going to keep going on. And then the ones that we don't get to, we'll make sure that we follow up with that as well. So Raj, you had spoken earlier about AR and VR. Could you talk a little bit more about, other than like what you've shown, other applications, or when you would choose either AR, VR, outside of like a hospital room, different types of things that you can do as well with the technology?
You mean outside of XR?
No, I'm sorry, outside of like a hospital room, because we have different roles, right? How could you apply that to different types of roles besides just those that are clinically based? Can we expand the virtual
Absolutely,
reality to other
yes.
roles?
Absolutely. So I'll give you guys one example. Like, we are building a program, a big program actually, on AODA, that is on drug abuse and child abuse. Right? That's where it's a immersive learning virtual reality experience where the convicts of child abuse convicts will go through with that VR program, and they will go through with the story of their life, where they'll be visualizing different aspects, how that particular individuals are acting. And then we will be having a full AI version of virtual avatar, counseling it to them and talking it to them, how do they feel about it. And it's a 4 stages that we are implementing: contemplation, pre-contemplation, and other things. So that kind of scenarios are coming within VR, also using more soft skill based trainings, where we can replicate and using this virtual human technology. That is very awesome. If you go on the virtual human marketplace, you will see that technology on ELDC page, which these virtual human technology is fully natural language processing. NLP is already implemented, and they can be trained on any topics, and within the AI behind that architecture as well. Plus, this was one topic outside of the patient care. Then there are so many modules that we have in plan, that is in the roadmap for EMS side of things, where we are replicating the outside environment of like a BLS scenarios, or EMS emergency scenarios related to ambulance, related to accidents, and related to all other things. That is possible in VR now, especially if you focus on the replicating the real world settings of photorealism.
Very good. Thank you for that, Raj. So Kevin, we'll wind up the last question to you, and then we'll address them. But keeping that in mind, and because of this so many different roles, right, that you're trying to acquire talent, and the challenge not only from that aspect, but for the multi-language approach on that. And now that we have so many different types of training solutions that we can suggest, right? Not only our standard, but also some advanced ones that Raj has shown as well. But from your perspective, current state, what you're doing internally right now to be able to, the question is, what do you use to be able to address multi-level roles training? Is it, we never do the one size fits all, right? We do different types of approaches, but language is a huge issue, right, as well. So how do you handle that diversity?
Yeah, I mean, I think we have to be thinking about the different languages that people are comfortable in. We already think about it a lot in healthcare today, in the sense of compliance learning, for example. It needs to be in multiple languages because people need to understand it, and we need to prove that they understood it in the event that we are asked by a regulatory body to prove that so-and-so knows how to whatever, put out an electrical fire or whatever. So we've been doing that for years. I mean, I think translation is a part of it. I think, this entire virtual augmented reality is another part of it, where this is hands-on experiential learning. And there is a language component that we need to make sure we incorporate. And because it's so hands-on, it sticks better regardless of what language you speak and regardless of whether you understand things differently. So I think that this is really the wave of the future. This is how people expect to learn as well. And as we think about different generations and attracting different generations into healthcare careers, this is how younger generations prefer to learn. And we know it works better as well. And I think it helps us with things like you're bringing up about around language.
Excellent. And that is so important as well. So, you know, I think that at this point we are at the top, at the top of the hour. I want to thank both of you, Kevin and Raj, you know, really great insights, not only from leading a healthcare system, from learning and talent management. So Kevin, thank you for that. And the 20 years of experience of working with you in different healthcare systems. So I appreciate that as well. Healthcare is definitely near and dear to my heart, obviously, from all the things. Raj, amazing insights from your side of it, what you and your team are accomplishing right now. Very proud that we're a partner of yours. And we look for, you know, more information as we move forward. And I thank you both very much for your time. I thank all of you that are attending today. Hopefully you were able to take something away. And like I said, we'll get additional questions back out to you, but you will receive a link in an email from this particular session, and it will also be out on our website. So for that, I thank you very much and wish you a really great rest of your day. Thank you, everyone.
Thanks, Kelly.
Thank you.